Market Prospects, delivering timely information and education to prairie farmers for over 30 years. Market Prospects is brought to you by the University of Saskatchewan's Department of Agricultural and Resource Economics and these sponsors. Log on to marketprospects.usask.ca to view past programs and for information on upcoming programs.
This week in our Market Prospects interview, we take a close look at the human health benefits from flaxseed consumption. Joining us is Dr. Grant Pierce, Executive Director of Research, St. Boniface Hospital, and Professor of Physiology and Pharmacy, University of Manitoba. Dr. Pierce, great to have you on Farmgate.
Thank you very much for having me here today.
Right off the top then, please give us some of the background and results relating to research looking at the benefits of flaxseed in human diet.
Can I take a step backwards on that and tell you a bit about the problems that flaxseed is addressing, and that is high blood pressure. High blood pressure is the #1 risk factor for death today and disability in the world. 19 out of 20 Canadians, if they live an average lifespan, will have high blood pressure. And it costs the Canadian economy right now, healthcare system, $10 billion a year. And what we found in a major trial, it was a 1-year tightly controlled trial in which patients either received flaxseed or they received a placebo, is that flaxseed controls high blood pressure, hypertension, extremely well as any drug that's out there today. And it would equate to, because we know increases in blood pressure cause increases in heart attacks and stroke, would equate to about a 50% drop in strokes and heart attacks.
So these studies are ongoing. Where are they going to go in the future then?
Good question. One of the questions I always get is, can I throw away my antihypertensive medication and just take flax? And we don't know the answer to that. So right now we're doing a study in which we're taking people who have mild hypertension and have never had any drugs to control it, and putting them in 2 groups, one receiving a placebo, one receiving flax, and they eat it daily, and then looking to see whether they go on hypertensive medication because it's blinded, and the physician just looks at them and says, okay, your blood pressure is going up, you'll need drugs or you don't, and so we'll eventually know whether this can replace drugs.
And how long will that research be carried on before you have results for the public then?
Clinical trials take a long time. The initial results that I talked to you about there earlier took approximately 4 years, 5 years to do, from getting regulatory approval from Health Canada to do the trial, right through to recruiting all the patients, giving them their food for 1 year, and then analyzing the results. So it'll be a similar situation with this. It's going to take a while.
Now, a spin-off, I guess there'll be spin-off from this for producers. What would it mean for producers in Western Canada?
Another great question. This really comes out of research from the Canadian Centre for Agri-Food Research in Health and Medicine at St. Boniface Hospital. We call it CCARM for short. And the goal in creating CCARM and the research at CCARM, just like this one, is that we want to look to see whether these crops have any health benefits. But if you know, 19 out of 20 Canadians, for example, are going to have high blood pressure, if you know it's going to be helpful for you in your blood pressure, your demand for that product is going to increase, right? And any businessman will tell you if demand for a product increases, what happens to price? Price goes up, crop acreage then goes up, and your demand for having flax in a variety of products will increase as well. So the farmer themselves is going to increase their profit from the price of flax and the crop acreage of flax. But the food processor, so all the way down the ag industry, the food processor is going to have benefits as well because they're going to be creating new products that contain flax. So that's the hope. That's the reason for CCARM and the research that we do there. It has health benefits, economic benefits with regard to health, and economic benefits with regard to the ag industry too. And most of the time, you know and I know, when we think of research, we think of it as this never-ending hole where money gets poured into and you get results out of it, but no economic benefits out of it. Well, here's a rare case where we're hoping there's going to be huge economic benefits for the ag industry and for the health industry too.
So how do we get more consumers, more Canadians on board with eating flax?
Well, I think we have to get the message out, just like you're doing right now with this, and we have to get, I think, the industry on board to understand the benefits, both from a health perspective and from an economic perspective, the opportunities that are there, the potentials that are there with flax in putting it into different products. And physicians need to know, too, that this is a viable alternative or just an additional option for them to add in with antihypertensive drugs to control hypertension. I might add that flax has a health claim to reduce cholesterol as well. So really it's hitting two of the major factors for heart disease in reducing bad cholesterol and also reducing high blood pressure.
Wonderful information, and we got the message out. Thank you very much for coming on Farmgate.
Thank you very much for having me. It's been a pleasure, and I'm honored to be here.
Okay, we'll take another short commercial break. Please stay with us.